your arms and your muscles, right? But when you fall asleep, you go limp, essentially. You lose the tone in your muscles, right? Well, when you fall asleep, you lose the tone in the muscles in your oropharynx, or in your mouth. So what happens is people who, it tends to happen when people are big and thick necks or obese, but it doesn't always have to happen. There are very many skinny people who have the same issue. You have a lot of tissue back there that when you fall asleep relaxes, it closes off your airway. And so what happens when somebody's sleeping is they go to sleep, their muscles relax, they close off their airway, and that snoring sound is them essentially trying to pass air. And what happens is you fall asleep, then you wake up, maybe not enough to wake up and say, oh, hi, good morning, but you wake up enough to regain the muscle tone, and then you fall asleep again. And that constant sleep-wake cycle puts a lot of stress and strain on the heart, which ultimately can lead to high blood pressure. It can lead to other things too. Those people are frequently sleepy, they're falling asleep at the wheel, and other things can lead to a bunch of other diseases, but really it can also lead to high blood pressure. Yes, question?
What is getting your tonsils removed? How does that help?
So certainly if you have a lot of excess tissue in your oropharynx, removing tissue, including your tonsils and adenoids, can also essentially open up that airway a little bit better.
My twin got his removed and he still snores really
Yeah, so sometimes it does. It's not curative. There are things, I don't know if anybody has somebody who wears a mask, and what that does is blow air. So when you fall asleep, when your muscles relax, the air gets blown in there and keeps your airway open. It's not very comfortable, but many patients who do it say, gosh, doc, I got the best night of sleep. I feel the most rested I've ever had. So if you know people who do, you need to tell them to ask their doctors to evaluate them for sleep apnea. Not so much because so that you can get a good night's sleep, but so that they don't develop high blood pressure. Yeah.
So is it like bad to snore? Because not every night I snore. I snore most when I'm stressed.
So there are a lot of I don't want to scare everybody. There are a lot of reasons why people snore. They're not always obstructive sleep apnea. Sometimes if you have congestion or something like that, you can snore and things. So that's why you need to be evaluated. And the evaluation, what they do is they check your blood pressure, check your heart rate, and then they measure to see whether or not you actually are stop breathing. And that's what we call obstructive sleep apnea. The problem is when you stop breathing. And not everybody who snores stops breathing. All right. Causes or the effects of hypertension. All right. So why do we care? So what? I'm walking around with high blood pressure. I'm walking around with a pressure of 160 over 100. All right. It's very high, right? Now what's the number? What's the number?
120 over 80.
Less than 120 over 80, right? All right. So why do we care? Well, because it can do damage. So some of the effects, essentially, as I told you, the heart is a muscle. So if the heart has to pump so hard to maintain that blood pressure, it essentially increases the workload of the heart and causes the heart muscle to get really, really thick and hypertrophy. And unfortunately, again, I don't have a picture, but down here, maybe you can see it on my screen. Here is a heart that looks abnormal. I know you guys have seen some hearts. This is the heart cut like a donut, all right? Essentially cut like a donut. And normally the heart thickness should be about, we call 10 or 11 millimeters thick, which is not, if I can imagine what that looks like, 1 centimeter, right? This heart is really, really thick. You can really appreciate it, having probably not seen many pictures like that, but it's really, really thick. And ultimately what can happen when that heart muscle gets really, really thick, at some point in time, that's how the heart compensates from the blood pressure. Just like a muscle, if I were to sit here and lift weights, your muscle gets big. Well, that's what's happening to the heart muscle. But ultimately, the heart muscle tires out and poops out and says, you know what, I can't keep up with this. And then the heart muscle, after it gets big and thick, starts getting big and baggy and dilated. So one reason why it's bad to have a big, thick heart is blood doesn't pump very efficiently. and we can get heart failure from a big, thick heart. But ultimately, this big, thick heart can then turn out to be a big, baggy, dilated heart. So a heart, instead of looking the size of your fist is your heart, it can get 2 to 3 times the size of your fist. So some people have hearts that take up their entire chest, versus the heart is supposed to be just the size of a fist. That's what we call heart failure. And the heart muscle gets extremely weak, and you have a lot of issues with that. Essentially, you can have problems exercising, moving around. You can have problems with fluid backing up into your lungs. You can have problems with fluid building up in your feet and other things. So if you have a big, stiff heart, that can happen. If you have a big, baggy heart, and a big, stiff heart can sometimes change into a big, baggy heart. So that's one of the main reasons why we need to control blood pressure. Go ahead.
So the bigger your heart, the higher risk you are of having heart failure?
So defines, it depends. And this is why you need to work with your doctor about some of this. Certainly as we get older, sometimes people have big hearts like those athletes. Many athletes, after years of training, it's actually a normal response for the heart to get a little bit big and baggy. But they're trained athletes, and this is the normal remodeling. But if you have high blood pressure, then the response is actually a negative thing. So it really depends. But for the most part, for most people, if you have a thick heart or a big baggy heart, it's not a good thing. All right. Any other questions? Yeah.
So like if somebody like they did like a lot of exercise for like a long amount of time and they just stopped, could that like?
No, not this. So the response to exercise is a good response. The response to high blood pressure is a bad response when you think of it that way.
So if like somebody just stopped, they wouldn't just get a baggy heart?
No, the heart would just remodel back into a normal size heart.
Oh, wow.
All right, Justin. Yeah. Anybody else? Good. Glad your picture showed. So the other issue is high blood pressure can lead to artery damage. Okay. So it can damage the artery walls, and essentially you can see here. This is what our arteries, the inside of that blood vessel. If I were to take, let's say this is the blood vessel, open this up and flay it out. That's what we're looking at here. Nice and smooth and glistening. These are our vessels that have come off of that main vessel. After years of McDonald's diet, high blood pressure, this is what your artery can become. All right? Craggly, full of plaque. If I were to ask you which would be easier to flow blood through, which would you say? Exactly. Nice and smooth, glistening, can flow through. It's a miracle that blood even gets through here. And so you'd imagine, again, remembering Poiseuille's law, with this being this and this being this, that the blood pressure would be higher in somebody who has this in their arteries versus the nice smooth ones. All right. As we mentioned, it speeds up hardening of the artery. It can damage other organs, most notably the kidneys and other things. Arteries can dilate and can get big and baggy and rupture, which is not a good thing. And then you can get blood clots that lead to heart attack and stroke. And we'll talk about stroke here in a second.
I have a question.
Yep.
So how long can a person live with their arteries looking like the valve?
Like that?
Yeah.
I would venture to say it just depends. Some people, if you're lucky, you can live and die of something else. But the reality is not many people are that lucky, and people die of this. So I can't give you a specific number. It depends. I would tell you that if you eat right, watch your weight, exercise, follow a doctor, and other things, that you can avoid this from happening. I catch people who have this kind of thing all the time. They have come in with strokes and heart attacks, and if we can catch them, they can then go on to lead normal lives. But many times it's too late. If you're out to this point, it's too late. My goal, and part of the reason why I'm here today, is to, while you guys are still like this, and arguably, quite frankly, we start putting the cholesterol into our arteries when we're babies, actually. There have been studies that show that we actually start depositing when we're very, very small. So the reality is this is the age where you guys are, where you need to develop the habits of eating right, of watching your weight, etc., exercising to avoid this from happening. Okay? All All right, so we talked about the issues of blood clots and other bad factors that can happen. Well, another effect of chronic hypertension is stroke, all right? And they almost go hand in hand. And there are two types of stroke, and this is what I have shown over here, is what we call an ischemic stroke. An ischemic stroke is a stroke where a blood clot goes to the brain and blocks off the blood supply to various areas of the brain. So that's what a stroke is. A stroke is when the brain doesn't get good blood supply. All right. So that can happen for two reasons. One is a blood clot forms and blocks a vessel in the brain, and therefore that part of the brain doesn't get good blood supply, and that part of the brain dies. Or what we call hemorrhagic, where blood vessel leaks, and either leaks in the skull or outside the skull, and that's what we call, again, a hemorrhagic stroke. Both of those are called strokes. The ischemic stroke is the more common. Yes?
Like, is it possible to get like a blood clot in like the main part of your aorta?
It doesn't happen frequently, but I have seen it. You get I've seen people clot off their aorta because their vessel, they've had so much cholesterol build up and plaque in there. It doesn't happen that frequently, but it can.
So would that like just kill you automatically?
So depends the timing of it. The body is amazing in the sense that it can sometimes grow new blood vessels, or what we have called collateral blood vessels. The main way for blood to get from your heart down to your legs is through the aorta. But if the aorta gets clogged off slowly over time, that blood will find other arteries that interconnect, what we call collateral, to find. So that person who had a completely blocked off aorta, who I saw, he had developed that over a long period of time and developed collaterals so that blood could still get down there. Not going the main way, but going around. And that happens. That happens in the heart as well. Yeah, somebody else had a question? So some of the symptoms of stroke, and this is important to know. The brain controls our speech, controls our body movement, and so some of these are the things that we need to watch out for. Some of the symptoms are sudden numbness or weakness of the face, an arm, a leg, especially on one side of the body. Because typically what happens is that if you have a stroke, one side of the body, blood vessel on one side of the body gets blocked, and therefore that side of the body that the brain controls loses its ability to move or sense things. Sudden confusion, trouble speaking or understanding. So many times people have stroke and all of a sudden they start talking really garbled or really, really confused, or start saying strange stuff, or you're talking to them and they're not understanding. Visual problems. Some people see persistent double or lose vision on one side, or actually even ignore one side of their body. How are we doing on time?
Yeah, about 2
Okay,
minutes.
we're close to finish time. Some trouble walking or dizziness, loss of balance, or a severe headache. This was just some of the main complications that can happen. We talked about most of them. Affects the brain. You can get problems with your eyes, the heart, the kidneys we talked about. And you're right, it says elevated sugar levels, diabetes. That's a soft call. High blood pressure is kind of all oftentimes wrapped up into one. So real question, how do you know if you have high blood pressure?
Because of that.
What you say? Right, exactly. How about any symptoms?
No symptoms.
Exactly.
That's what I know.
Yes. Very good. Very, very good. I gave this to 3 classes last year, and everybody was running out all these things. And the reality is exactly that. So the ads are right and telling you right. There are no symptoms to high blood pressure. When you do develop symptoms, it's too late. All right? That's why we call high blood pressure the silent killer. The only way to know if you have high blood pressure is to have it checked. All right? Is to have it checked. So again, there are no symptoms. People talk about headache and all this and that. Yes, those can be caused by high blood pressure, but the reality is if you wait for those symptoms, it's too late. By the time you have symptoms, the high blood pressure has already done damage to those organ systems. So you have to have it checked. Last couple of slides, the epidemiology and why this is really, really important is stated right here, 40% of the non-Hispanic blacks